What's going on, guys? Tony Maritato here, licensed physical therapist, and I want to talk about range of motion through the shoulder. So following a rotator cuff repair surgery, or maybe you never had surgery and you just feel that the shoulder is limited in your range of motion, there are a couple ways to approach this. So everybody kind of thinks of, I need to stretch the shoulder, I need to stretch the musculature, but really the musculature might not be the problem. So we have the muscles, let's say pec major for an example. It's going to be an internal rotator, an adductor. It's pulling the arm forward. And when we talk about, chronic postural issues, everything we do is in front of us. We're driving, we're typing, we're doing all of these things. Yes, it does tend to bring us into this forward rounded position. But that being said, the musculature is not always what's limiting the range of motion. So we need to understand the other structures that are involved and how we stretch those other structures differently. So a typical 30-second, 60-second static stretch for the muscle is fine, but what about the connective tissue? What about the joint capsule, the ligaments, the things that hold the structural components in place when the muscles aren't working? I find that those tissues respond to a longer duration, lower intensity stretch. They tend to respond to what we call creep, C-R-E-E-P. Creep is essentially when I put a non-muscular soft tissue on tension. With time, it'll actually start to lengthen. And so there's mechanical forces at play here that I'm not going to get into. But one of the ways that I like to stretch the shoulder when I'm not trying to stretch the musculature, but I am trying to stretch the connective tissue, is in that long 2 to 3 to 5 minute range, comfortable positioning, moderate intensity stretch. And then I like to add the massage gun component to it. Now, this is a massage gun made by Tiaha. I've been testing it over the last couple weeks. It's been doing phenomenally well. And so I just want to show you, let's say for example, I'm dealing with a right shoulder issue. Maybe my external rotation isn't where I need it to be, whether I'm in a throwing sport or I'm doing anything related to overhead positioning or something that needs external rotation. So what I do is I would lay not just flat on my back, but kind of quarter turn. So my shoulder blade is actually now sitting flat on the ground or the mat or anywhere I am. I'm gonna bring the elbow to about a 45-degree angle relative to my body. So if this is 0, this is 90, I'm at 45 degrees. And as I let my hand drop back, now I don't have tightness or range of motion restrictions, but for somebody who does, when you get back to this position, this is where it starts to get limited or a little bit tight. So this is where I would potentially hold a small weight, 1 or 2 pounds, not more than that, because if you go heavier, if I put a 5-pound dumbbell in my hand, my pec and my musculature is gonna activate to try and resist that motion. I want something light or even just the weight of the hand itself to let gravity pull me back into this position. I'm gonna flip my little massager on. And what we're gonna do is, we're just gonna allow this, sorry for the vibrato in the voice, we're gonna allow this to kind of stimulate the touch receptors in the musculature and the areas around the joint capsule. I'm not really doing anything to the joint capsule itself. I'm stimulating the receptors. I'm giving my nervous system information other than the feeling of pull or stretch so that it's a distraction. And while I'm distracted, it's going to allow that arm to drop back into that full external position. And so this might be something I do for 2 to 3 minutes. As time goes, what should happen is the distance between the base of my thumb and the surface I'm laying on will decrease with time. And that's how I can objectively measure the improvement. Now, once I've got full range of motion in this position, quarter turn to my side, then I would want full range of motion in this position, flat on my back. Both of my shoulder blades are touching the surface. The base of my thumb is resting comfortably up around my head level. This would be full range of motion. And again, I could use the massage gun to simply stimulate the soft tissue around the area to function and act as a distraction, allowing my nervous system to calm down and stop guarding, stop protecting, to allow the connective tissue to stretch. So usually I'll ask my patients to do this 2 or 3 times a day initially when they want to get improvement. Maybe you're doing CrossFit, you're trying to get a front rack position, you just don't have that external rotation in place. This is a great option for you. So experiment with it, think about it, play with it. Obviously, if it causes you pain, don't do it. This is not medical advice. I'm simply trying to educate the public to let you know, hey, there's lots of different ways to do things and achieve the goals that we want. I'll catch you guys on the next video.